Welcome to Wellness Fixes the Pod, a by Maven media production, where we believe you deserve real education from real experts delivered in a way you can actually use. I'm Dr. Kelsey Vick, your board-certified orthopedic doctor of physical therapy, and this podcast was built for the girl who is done feeling overwhelmed and frustrated by conflicting health noise and is ready for something she can actually trust. Every week, we have honest, science-backed conversations about your health, your hormones, your brain, your body, and everything in between. No fluff, no fear-mongering, just the truth. Because understanding your body is the most powerful thing you can do for yourself. A table full of experts built for the curious girl who wants the truth. So welcome. Your seat is waiting for you.
If there's anything that I've learned from all of my years in practice, it's that skin really loves consistency. Nothing is going to happen overnight, and trying to change it right before the wedding is like the biggest downfall of most brides. Like, if you're somebody that's in the realm of having static lines, like Botox can be life-changing, truly. And then the other thing that's my pet peeve is expensive skincare that, has weak evidence. Like, save your money for Botox. I don't think the price is justifiable. If you're advertising it on TikTok and it changes your skin overnight, it's usually too good to be true. My most honest advice is just like, your wedding week is not the time to chase better skin. It's really the time to protect the skin that we have spent a long time building.
Today's guest is someone I have been genuinely excited about to bring on the podcast. She is a board-certified nurse practitioner and doctorally prepared clinician trained at Columbia University, where she also served as faculty. As a cosmetic injector, she brings a philosophy deeply rooted in French beauty and wellness, an ethos built around elegance, simplicity, authenticity, and the idea that beauty should always look like you, just a little bit elevated. Her methodology is grounded in a deep understanding of facial anatomy and evidence-based techniques, and the results speak for themselves. I really wanted to have her on the podcast to chat all things prepping your skin for a big event, especially for my brides preparing for their wedding day. So I can't wait for all of us to learn from her today. Claire, welcome to Wellness Fixes the Pod. What is the most common mistakes that you see brides make when it comes to their skin before their wedding day?
So number one, I think right before the wedding, there's this thing that, I was guilty of it myself. There's this thing that brides do where they panic change everything right before the wedding. If there's anything that I've learned from all of my years in practice, it's that skin really loves consistency. It does not love this chaotic spiral that involves initiating a retinoid last minute or trying some new TikTok serum. Nothing is gonna happen overnight, and trying to change it right before the wedding is the biggest downfall of most brides. After that, I would say over exfoliating, whether that's a chemical or a mechanical exfoliator. I grew up in the era of the apricot scrub, the St. Ives apricot scrub. Anything, I get it, brides want to glow, but anything that's going to really disrupt the skin barrier is going to be a huge problem, because it's leaving these little areas and for infection to get in. It can cause breakouts. It will give you this inflamed, maybe shiny, but really angry skin. So I think just getting rid of exfoliation that's consistently used every night or multiple times a day is the best thing that you can do leading up to the wedding. I'm not saying don't exfoliate, but I see these brides chasing the glow and essentially trying to just scrub off the top layer of their skin, and it only leads to bad things like makeup sitting weird or this really stingy, angry skin. Starting actives too late. Actives are really powerful. Those are things like retinoids and vitamin C serums and pigment ingredients, but they require time. And my mom always says good things take time. Starting one of those right before the wedding is going to have really minimal effect. It's not going to create big changes in the amount of pigment or the texture of the skin, but what it will do is it risks making you really irritated. So I always say definitely use actives. They're very powerful, but starting them right before the wedding is not going to tilt the needle or change the scales in any meaningful way, and it's going to risk undoing any of the work that you've done because of either compromising the barrier or what have you. And then the other thing that is my hard stop as an injector is doing any first time procedure right before the wedding. So a lot of patients will come in and they think that, you know, you need Botox right before your wedding and that will be the cherry on top. And the reality is that you've never tried any of these treatments before and you're seeing a new injector. There's just as much the possibility that you hate the result than you feel like you look better or you like it. And so while it's temporary, Botox, once it's active, there's no undo button. Like it's the equivalent of cutting bangs. Like you just have to wait for them to grow out, which is never a good position to put a bride in, is to do something that's not reversible. So I always say, like, never make your wedding the clinical trial. And it's a really tough pill to swallow because I think like a month or two before the wedding, you feel like you have all of this time to do things, but procedures are never one of them, especially really close and like leading up to it. You can have bruising, number one. So if you're really like within that 2-week window, you don't want to do anything that's going to leave you with swelling that makes you look strange or have to cover up a big bruise or any of that. While I'm very good at what I do, and I have first-time brides come in like 8-week period before their wedding, I usually turn them away. And I have a 90% return patient rate. I mean, patients are really happy and satisfied with the results, but it's just not worth it for the bride, but it's also not worth it for me because then I'm going to be like managing all of these patients right before if anything doesn't go perfectly. So I always say, like, all eyes are on you for wedding day as the bride, and it's better to look like yourself than to look super strange. What else? What's my last one? Things like ignoring pigment right before a wedding is super important. So a lot of people forget that pigment is driven by sun exposure and like UV exposure, but it can also be driven by heat, which two totally different things. Being on a beach in the sun is UV exposure. It's also a little bit of heat, but being in a sauna can also really flare melasma. So that's like a different type of heat that I like to have people think about. And so I like booked this weekend in the sun when I went for my bachelorette leading up to my wedding and like obviously flared all of my pigment, which was a big rookie mistake. But like my brides that go on wellness benders and decide to do like a whole weekend at the spa with their girlfriends, like sitting in the sauna and steam room while you think it's gonna help you can actually derail all of the hard work that you've done with, you know, minimizing the pigment that you've had and, you know, especially if you have melasma, like creating issues. So it's really a hidden culprit that I think people forget about. Essentially, my hard rule is just like the closer we get to the wedding, the more boring we become. So boring skincare is bridal luxury in my book.
I love that mantra too. I'm like, this is, I feel like why I really wanted to have you on the podcast, because I know that your philosophy in general is let's do more natural looking procedures and treatments, especially before a big event where you're like, okay, yes, I am a cosmetic injector. Yes, I am great at what I do, but this is not the time to be doing that. So I think that restriction and that pulling back, whether it's from treatments or skincare, especially if someone's new to this, is like a very, very hot tip.
It honestly doesn't even matter the amount of injectable or how much you've been doing, like the months leading up to the wedding. It's really, truly like you get to a good place. And as someone in medicine, you really start to understand like everything that you do in life, but especially with medical procedures, like there's a risk and a benefit. And it's not like I'm going to do this and I'm going to have this perfect end result. You really have to weigh the pros and cons and say, okay, if I break out from this thing, like, is that going to be okay? Am I going to have enough time to fix it? Or is that going to derail everything that we've done? And I think those are really good questions to ask because people come in thinking like, oh, that provider can fix my under eyes or that provider can do this thing for me. And like, it's not, you know, injectors, plastic surgeons, like we're not robots. It's really an art. And so obviously first and foremost, you may have a different opinion of what's aesthetically pleasing than I do. And there's always a risk for that. But also things can go awry, just like you can take a new medication like Tylenol or whatever and have like a side effect or an allergic reaction, God forbid. So I always say like, yes, they're incredibly effective. More likely than not, you'll have a great outcome. But is it something that like before this momentous occasion that you want to gamble?
Yeah, complete risk benefit sort of analysis that needs to be totally individualized. When we talk about timeline before the wedding, what should brides in their engagement era be thinking about 12 months out, 6 months out, 3 months out? Like what should they be thinking about at each of these different phases if they want to take this more like long-term approach to helping their skin look its best on their wedding day?
Okay, so a year out, I always say this is like the point in time where you figure out what you're dealing with. Do you have acne? Do you have acne scars? Do you have melasma, redness, texture, dullness, laxity? Are you dealing with some volume loss? Usually, like, my brides are younger, so volume loss is not as big of a deal, but like, you know, some patients are a little bit older and they've noticed that their fat pads have diminished with some time, and you start to formulate like a good skincare plan. And from my chair, most of the work that I do is needle-based or like injectables-based, right? Like Botox and fillers, but none of that is going to look good if you don't have good skin. It's what's draping all of the work that we've done together. So I always say, like, come up with your skincare plan for the next year, which should involve things like a daily sunscreen. It's a non-negotiable. The American Academy of Dermatology recommends a broad spectrum SPF 30 or higher. And, you know, I think prevention is like the bulk of what you're doing. After that, after you've gotten your skin to this like good place, you can add in things like retinoids or come up with a pigment plan. But like, we want to start on the foundational things, which is to create a healthy skin barrier so that your skin is functioning optimally, and then doing things that are going to prevent anything from getting worse leading up to the day. After that, like retinoids at night, if appropriate. They have strong evidence base for treating acne and meaningful evidence for like photo agency, but they require a lot of time, and more than time, consistency. So I would not start a retinoid for the first time, like we said, right before the wedding, but like a year-long plan with consistent use is really enough to see like meaningful changes in the skin, especially when you're talking about pigment, texture, and like luminosity, which is what brides are always want to go for. They also stimulate collagen, and we are evidence-based, you know, medical providers, so I think there's a lot of data out there to support their use. Other things that are really worth thinking about at the year mark are like a pigment plan. If somebody has melasma or brown spots, that's like looking for a little bit of brightening, things like vitamin C serums, kojic acid, hydroquinone in the right patient, azelaic acid, those are powerful tools. Pigment is super nuanced. So the most important thing is that the provider that you're seeing should be targeting what the underlying cause is for why you're developing or you have developed that pigment. So don't just throw the kitchen sink at all of this. I think the most important thing is to, you know, really analyze why that pigment has developed so that you can target it with things that are clinically effective. And then at that 1 year mark, I would say procedure planning is we start brainstorming and deciding when we're going to do treatment. So this is a time to talk about lasers, microneedling, vascular treatments, even talking about if we have acne scarring, and then planning out like filler if needed and a Botox trial. So I usually will have brides like count back 6 weeks before their wedding, and that will be the last possible moment where we would do Botox, and then we count back from there to do a trial. So that's like my 1 year mark planning. Around 6 months out is like this refinement window, which is when I like to have the core routine stable. So the skin is functioning optimally. We've done all of those things to start chipping away at any type of redness, PIH, brown spots, melasma, and then at that point I like starting to tighten the plan. So for a lot of brides, this might include doing a Botox trial if it's something that they want before the wedding. I always say, like, I'm in the business of I want, not I need. Just like you don't need to wear makeup for your wedding and you don't need to have somebody else do your makeup, but if you are going to do it and it's something that you want, you definitely should have a trial. And I think people really forget about this. You do a trial for your hair, you do a trial for your makeup, you should absolutely do a trial for your Botox. And essentially, like, we need to understand what's the look that you're going for. So we want to understand what dose we're going to use, how we're going to place it, what your brow's response to it is going to be. So it's really good to like usually patients are really happy after they try it for the first time, but there are definitely things that we can tweak and refine. I'll have brides like send me a little photograph once it's fully kicked in after day 14, and then we can like plan and tweak things for the final day. What else? Lasers. That's the point in time where like at 6 months you're doing the bulk of your lasering. Lasers can improve everything from pigment to redness. They help with texture. They can fight signs of photo aging. There's different evidence for different wavelengths, and it can be super nuanced. Like laser physics is its own area, I think, of aesthetic medicine. But, if you talk to a provider that's like really well versed in how to use all of these things, you can have pretty outstanding results. I will say that not all lasers are created equal and not all providers are created equal. So, where you're going to do these things, you can get widely varying results based off of the knowledge of the person operating the device. So I think I see a lot of brides looking for a specific laser. They're like, oh, I want to do a Moxie, or I want to do whatever it is. And the reality is that you should be seeing someone who's highly trained on how to use those devices, because you can have problems, you can have burns, you can flare pigment. I think, that 6-month mark is when you should do them. Maybe start doing your research a little bit before. I think this is like a good time to do filler if it's appropriate for you, like truly figuring out if you're the right candidate for it. If you have a little bit of volume loss, filler can age you and really distort you, and it can photograph really strangely. And I'm not anti-filler, but going to see a highly conservative injector I think is really essential. Someone who's going to be truly honoring like an individual's essence and not creating a new face for them, or totally changing their appearance. Like what the type of work that should be done are things to really refine a bride's appearance. So sometimes that's like a little extra hydration in the lip, or one of the fat pads project a little bit more to support the under eye, say in the cheek. But all of these things you should be really aligned on with your injector. You should feel that they have a similar aesthetic eye to you. It's like getting a haircut, like that you're able to communicate what you want. I once brought in a picture of highlights for my hair, and the hairdresser cut me a bob, just came up and cut me a bob. And there was just this gross misunderstanding that I was not communicating to her that I wanted short hair. I came in for highlights, but she saw the picture and saw a bob and decided that we were cutting my hair. So really having those conversations and understanding exactly what a provider is going to be doing, and that they're aligned with you and that you trust them, is really important. And thinking about 3 months out, 3 months is still plenty of time, but it's really not the time to reinvent your face, essentially. This is the time to really lock in your routine. So no aggressive product experimentation, keep doing what's working. Do your final Botox around week 6. Some providers will do week 4, but it will be fully kicked in and lasting, still a good amount of time for the wedding and the honeymoon. It just gives you enough time to get the full effect of it, do any small tweaks if you do need a touch up, and it allows it really to soften and settle. So I always say if you like your Botox around the 2-week mark, then you'll love it at 4 weeks, and it'll carry you out until it peters on out around 12 weeks. And then I will have brides pretty much avoid major filler unless we planned for it or we have a really strong relationship, just because when it's down to the wire, like I said, you don't want to be dealing with bruising or swelling or something not settling perfectly. That's my practice. I know plenty of injectors that will, do lips maybe 2 to 3 weeks before the wedding. I don't want to, I want to get everything perfect, and it should last, filler should last longer than Botox. So doing those treatments and having them be really thoughtful and planned is my vibe, and I don't do anything that's reactionary or deciding we want to do something last minute before the wedding. Do only familiar, predictable skin treatments. So if you've done peels before, a gentle peel, I'm totally fine with you doing that around the 3-month mark. Or even one of these Clear and Brilliance, or a light laser if you've never reacted poorly to it. But a first time aggressive resurfacing treatment is not okay with me, absolutely not. I've seen brides really break out from even trying microneedling for the first time, or trying a celebrity facialist for the first time because they think they're gonna reinvent their skin. Just don't risk it. All of these procedures have some degree of risk, and it may be small, but if it happens to you, it's 100%. So in those few weeks leading up, prioritize hydration and like barrier repair, or like really strengthening your barrier. And it's all about making your face be makeup friendly, like having things lie really nicely on your skin. Like the best looking skin is healthy, like luminous skin. And if you've done any of those things or have issues, whether it's from like actives or lasering or whatever, like you don't want to deal with like dry flaky patches and like the trial that you did not working out for the day of. That's like my little breakdown leading up before the wedding.
I love that timeline breakdown too, because as a physical therapist, I come at it from like the exercise side of things. So I see all of these like bridal arms, 6 weeks bridal arms series, like body recomposition stuff. And I sort of mirror what you're saying to those sorts of programs where it's like, we're not crash exercising, trying to get the body we want for our wedding day, for the wedding dress 6 weeks before, just like we shouldn't be doing that with our skin. Once we're like, oh shoot, the wedding's coming up a lot quicker than what I thought. Let me get all of the skin stuff done. Like, I think this longevity approach to it is super nice. And I also look at it from not only like a body recomposition standpoint, but also from like a skin health perspective of the wedding day might be your motivation to get a lot of these things done, but it's also okay to use it as this like deadline to try and get your routines in order, whether that's like fueling or your movement routine or your skincare routine. Like it might just be that added extra motivator to allow you to put a little bit more effort that you want into whatever routine you're trying to build that sticks long after the wedding day. So this sort of like longevity approach to it, or this preventative, like giving us enough time to either get you the body recomposition results that you want, the skincare results that you want, how you want to look and feel on your wedding day. Like, I think that is huge. And I think a lot of brides think about it with their hair. I feel like the hair is like, you know, I'm going to get my color trial. Oh, and nails too. Nails, like pedicure, manicure, they're like, oh, I have to like get all of these trials done. But I don't think a lot of people think about it when it comes to their skin. They think about it 6 weeks before and they're like, oh my gosh, I need to get, you know, all of these treatments done. So I appreciate this sort of like timelined approach and helping people understand, like giving yourself that, you know, from proposal to wedding. I feel like the average is probably 12 months now, if not a little longer. So I think it's just like this helpful time to dive into like taking care of your skin and getting that professional consult of like, okay, this is what I would like to see happen. And here's like when my wedding day is. Use that as sort of this motivator to get everything on track a little bit. So what are some of the non-negotiables that every bride should have in her routine, regardless of budget? I know you mentioned SPF, but are there any more that you sort of recommend that brides have in their routines?
I think it's less of a product and more of a philosophy or lifestyle, which is that when you can't buy this, it's consistency. The best I can think of, like for an analogy, is like if you're using retinoids and you're using a super high dose of tretinoin, like 0.05, whatever it is, and you can't tolerate that and you're not using it consistently, you're never going to get results from it. The goal is to be able to use it every 2 to 3 nights, maybe even every other night if you can, and consistently use it and tolerate it so that you can reap the benefits of using that product. So I think consistency is the one thing that like is a non-negotiable, whether that's that you're using those pigment products or, you know, even with procedures, if you decide that you're going to do microneedling as like a plan to get ready for your wedding day, like consistency is the one tool or gift that I would offer my brides. Apart from that, like maybe an azelaic acid that's very specific for patients that are dealing with rosacea or like redness. I love, you know, starting your bride on azelaic acid. People don't really realize how much that vascular like pigment really affects their overall appearance. And I see it also just when patients use lasers like an XLV or vascular laser to treat redness. Like nothing, it's almost like nothing was really done, but like everything was done. It just gives you this like refined canvas. We touched on SPF. We touched already on retinoids and using them consistently. Yeah, so I would say like it's more of a philosophy. Like I could tell you all the things that are great for a skincare routine. It's never one thing. It's really, you know, this idea that you're going to protect, prevent, repair, and correct the skin. That takes a long time. And so if you're using all of those things and doing all those things, which they're pretty simple. Most women these days I think have a nice cleanser, like a gentle cleanser at home, like a Cetaphil or whatever, a vitamin C serum, a little bit of a retinol or retinoid, even if it's not prescription, and like a good sunscreen. Like truly it's not complicated. Just using those things and using them consistently is like, for me, the non-negotiable thing that you must do.
So you've mentioned a few sort of treatments and different procedures. And I also know that a lot of these questions are so individualized, which is why I feel like a consult's like super, super beneficial and super necessary. But can you talk through some of the different treatments and procedures that you've seen actually move the needle for brides, and then which ones might be a little bit too overhyped?
Yeah, so I think if you've never tried Botox and you have I always like to talk about lines as either being dynamic or static, right? Lines that you form when you're expressing, so when you smile, you get crow's feet, and then these static lines that still appear there when you're not making those facial expressions. Like, if you're somebody that's in the realm of having static lines, like, Botox can be life-changing, truly. It will help makeup not crease and sit in those like fine lines that you have, and it will give you this rested and with the right placement lifted look. It should make you essentially look like I slept, I'm hydrated, like not that you're frozen and like shiny like an ice skating rink, but it should smooth everything out and be like this in real life airbrushing. So I think Botox truly can make a huge impact and really does move the needle when you're talking about things that appear to make you look less old and just more rested and that kind of stuff. And then vascular lasers for redness, like I think in the right candidate, rosacea, broken capillaries, and just things normally that you're trying to cover with makeup. Like I couldn't laser when I was pregnant, but when I got pregnant, I got like this redness around my nose. And I couldn't get it to go away, but then after I delivered, it just went away on its own, I think because I was less vascular, and it just made me look so much better. So I think getting rid of those like little red patchy areas or diffuse redness really does make a huge difference. And patients can usually use like an XLV or a V-beam laser, and that is like a home run. What else? Like little lasers to target pigment. I love a pico laser, especially in higher Fitzpatrick patients. It uses photoacoustic waves, so it's not going to be something that puts a lot of heat into the skin, which is good for anybody that's darker skin tone or has like essentially melasma or something that's driven by heat. And it can really like find a little brown spot and just like blast it off of your skin. They're like things that you can do to generally resurface the skin that I think really do make a nice difference in just like overall glowiness and perfecting like small little imperfections or like erasing small little imperfections. And then like subtle filler will make a big difference. Patients a lot of the time will come in like complaining about these circles that they have under their eyes, and I never love to run and do under eye filler, but like supporting the mid cheek a little bit just to help, you know, raise up the tissue to support the under eyes can make a huge impact. Or giving a little bit of a cheekbone so that the contours of the face are really young and youthful looking. Or even somebody that like has a little bit of asymmetry in their lips, or has a fuller bottom lip, like trying to get that top lip to be a little bit fuller, will just harmonize everything in terms of like when you catch like a picture from like your side profile, or if the light is hitting in a weird way, those like things do tip the scales. In terms of overhyped, I would say like random bridal facials with no plan. Like a facial can be lovely, but it's, you know, if it's like aggressive extractions, like these unknown actives, weird fragrances that they're using on your face, harsh exfoliants, like especially before the wedding, it can absolutely derail the skin. And then the other thing that's my pet peeve is expensive skincare that, you know, has weak evidence. Like I like actives that have a good body of evidence and like research behind them. I think if you're going to use these things that are like, they're meant for people to have a luxury experience, essentially, like that you know, feel a specific way when you're using it. Like, save your money for Botox. I think if you're just doing it for the way that it makes you feel when you apply it, like, go for it. I love a luxury experience, but I don't think the price is justifiable. So a lot of the times, you know, those things can make you feel like a little bit more hydrated, but on the other end, you've spent a lot of money and maybe you have a weird reaction from it. So I usually will tell patients, like, you don't need super expensive things in order to achieve really good results. What else? Things that are overhyped, last minute, like kind of quote unquote glow treatments. Everybody comes in, you know, like finding something on TikTok and using that, and you know, if you're advertising it on TikTok and it changes your skin overnight, it's usually too good to be true. And too much filler. I think Cameras are not kind to overfilled faces. Bridal beauty should let you emote and smile and photograph naturally. So I just would be really weary. Like, judicious and conservative filler can be good, but doing anything that's going to be overdone, obviously nobody wants that, but it can change really quickly. Is not ideal.
So what's one thing that you think brides often overlook when it comes to their wedding day? It can be like this secret ingredient, a secret sauce. Like, what do you feel like a lot of brides miss when it comes to helping their skin look its best on their wedding day?
So I think the most important thing, especially like the weeks and days before the wedding, is just barrier health. Everyone talks about like, you know, all the treatments that you can do leading up to it, but the thing that makes skin look really great in real life is a calm, intact barrier. It's luminosity and the way that the light hits super healthy skin. So when the barrier is healthy, then your makeup sits better, texture looks smoother, skin really reflects light nicely. Your redness is usually reduced because you're not inflamed from, you know, doing things that have aggravated the skin, and you look more hydrated. Like, healthy skin looks and usually is very hydrated even before the sprays and the highlighters and all of that. So stop over cleansing, stop over exfoliating, moisturize like it's part of the treatment plan, because honestly it is, and don't introduce a new product close to the wedding. The other piece I will say is that like sleep, hydration, you know, minimizing alcohol intake and salt intake right before like matter more than what people want to admit. And a lot of people will have these welcome events right before. That's not the time to get loose. You know, have a few sips of wine or like a little cocktail, but you know, the evidence for sleep and general health and alcohol avoidance is much broader than just bridal specific skin studies. But clinically, like poor sleep, inflammation, they all show up on the face. So I think it's lower quality evidence for like wedding glow specifically, but it's very real in practice. My most honest advice is just like, your wedding week is not the time to chase better skin. It's really the time to protect the skin that we have spent a long time building.
This conversation was everything I hoped it would be and more. Claire, thank you for bringing your expertise, your philosophy, and your honesty to this conversation. I learned so much, and I hope all of you guys did too. All of Claire's links for booking, if you happen to be in NYC and want to go see her, I will leave that link in the show notes below, in addition to her Instagram and TikTok links. That way you guys can go learn from her and follow her on social media. Thank you guys so much for being here, for joining Claire and me in this conversation about bridal skin prep, and I'll see you guys again on the next episode of Wellness Big Sis the Pod.